And hello, Dr. Murray.
Hi there, Philip.
And I understand with all your activity, you're into something else, something new.
Yes.
What are you up to now?
Okay, I'm now deputy editor of the Archives of Otorhinolaryngology and Head and Neck Surgery. Ear, nose, and throat doctors are scientists, and as scientists, they can make scientific observation and put it on paper and let us publish it. There's so many new things, new antibiotics, new resistant organisms, and so on. Normally it takes 2 or 3 years before you submit an article and it gets published. We don't have that kind of time anymore. So what we've done with the Archives of Otorhinolaryngology is to not so much speed it up, but give an opportunity for other people to get in there.
Oh, so you'll be utilizing doctors from other countries.
Oh, yes. You see, we don't know where the solution for the cold or ringing the ears is going to come from. There are doctors who have different experience, different background, and the Archives of Otorhinolaryngology are there for them to submit their articles and let us help them get it in position for publication.
That's excellent. So you're encouraging doctors to submit their articles.
Oh, absolutely. And again, just because you're not in academia doesn't mean you can't come up with great ideas.
True.
And we encourage doctors from all over the world to, after all, remember, some of the most important discoveries are from the forests of Brazil. We do encourage doctors from all over the world to show us your writing. Let our editors give you as much assistance as we can. And again, today we have new methods of education. We'll list your video. We'll list your links to your PowerPoint display. And this will help promote your ideas. Another thing too, your idea will be printed, published, indexed, so that everyone will know exactly who came up with this new idea. And that's important too. Watching 50 PowerPoints, only a few of them are really important.
Yeah.
So what we're doing is what I call the art of publication. We're going to take the 4 or 5 best PowerPoint slides and publish them with the article. That way the doctor reading the article will remember those important points from the PowerPoint.
I think this is excellent. This puts me in mind of way back when with Sir Alexander Fleming and penicillin.
Right.
And that discovery and how that had to be publicized.
Exactly. And the other thing we're doing is, because we are global, we're going to define all these abbreviations, because the abbreviation in one culture may not be the same as the abbreviation in another culture.
Yes.
Again, that's another reason why we invite doctors from all over the world.
You once told me that your best idea came from meeting with the yoga master. What was her name?
Indra Devi. She insisted that by sniffing salt water in and out at a certain rapid pace would helps her prevent catching a cold. And what I realized was that what she was doing was massaging the turbinates of the nose and getting the cilia back and forth. And so I used a device. I developed a device that does this. It pulses and it gets the cilia back and forth. But I never would have come up with it if I hadn't been with Indra Devi.
And for those who don't know what it is, what is cilia?
Cilia is little tiny hairs in the nose. They're microscopic. And when the bacteria gets in the nose, these cilia move the bacteria out of the nose, down the throat, into the tummy, where they're taken out by the acid.
I see.
And the fancy name for that is mucociliary clearance, which means you clear the mucus out of the nose.
But you have been, what we're talking about, in some really unusual areas of medicine. haven't you?
Well, as you know, one of my articles, one of my books is called "Stress, Anxiety: Your Cure is in the Mirror,"
Yeah.
where we talk about
Yeah.
measured breathing, and a lot of that also will be published in the archives of otorhinolaryngology as it applies to therapy for people. Again, reducing stress may be the answer for clearing tinnitus. See, there are so many fields, biofeedback, wavelengths of light, and so on and so forth, that have not been applied to ear, nose, and throat. And the archives of otorhinolaryngology are looking for those fields so we can publish them and have other doctors learn to use them. We encourage the doctor, the scientist, to come give us, write up their idea. The editors will do their best to help formulate in the best possible manner, and we're going to use all modern knowledge and techniques to get this information out there so people and patients can benefit.
Good. And finally, you of course are still very much in practice. Here, where? In Beverly Hills at Cedars-Sinai?
Cedars-Sinai, yes.
Cedars-Sinai?
Yes.
Okay. Well, folks, you've heard from the best, and he is. So, thank you again, Dr. Murray Grossan. Thank you very much for being
Been my
our
pleasure.
guest.
Thank you, Phil.
Okay.